is your take on cancer in this area? How prevalent is it, and what types are sort of at the top of the list?
Well, some of the major issues are around areas like lung cancer, certainly breast cancer, prostate cancer, colorectal cancer. Those are the 4 big areas. When we look at our region, we have some special challenges. In terms of the absolute number of lung cancers, we have one of the highest numbers in the province.
Okay.
And
what do you attribute that specifically to?
Well, when I say it's the actual number, what it means is when you adjust for the age and the population, but we also have a higher smoking population and people who have previously smoked as well, and we have a lower socioeconomic status in some areas. So this is a special challenge. So when we look at the numbers, we know that particularly in areas like lung cancer, we want to do better. That has led us to develop some specific programs for that. One of them is the Lung Diagnostic Assessment Program.
Okay.
So someone from an abnormal screen or a chest x-ray or a symptom that might be lung cancer, we have developed a program that facilitates the tests, the specialists, the support they need.
I guess time is of the essence, right? So ultimately you're pinpointing what it is, and the time can be reduced, the survival rate's going to be higher. The point of today's lecture that we were having, a lot to do with, and you're saying as an oncologist too, it's always you don't want to be doing 5 years from now what you're doing right now. So we're talking a little bit about where we are with cancer these days in the treatment, and where are we going to be in the future. So what are your thoughts on that?
Well, one of the big areas is around screening or early detection. We've had breast cancer screening, Pap test for cervical cancer, we've had colorectal screening, but what's new is that we are integrating or putting those together as a package, and we are going out to each of the communities looking at maps of what areas haven't been screened as well as maybe they should, and enhancing that.
So what does it mean getting the Walker Center into the St. Catharines area for the future of treatment here?
Well, it will mean that patients can receive care that's excellent care. When they enter the cancer system, we're coordinating that they would see the right people, the right place, and preferably as close to home as possible. And that will include radiation treatment for the majority of patients in Niagara. And that will mean they don't have to travel, and that their care would be coordinated. But in addition, it will mean that we can treat patients who did not have access to that treatment previously.
So what are your feelings of this new proposed South Niagara Hospital?
As part of the medical leadership in the NHS, we've had a lot of discussions, a lot of input into Dr. Kevin Smith's recommendations, and overall we're viewing it as a very positive step forward. There are always questions, concerns, discussion that needs to happen. Certainly one of the areas is around transportation between the areas, also around consolidating something like maternal child care in one facility. But I think we want to support the positive things that this would bring to Niagara.